Today we are going to discuss our new unit, eyeglasses. This is a long unit, so please be patient. The glossary definitions are very important, as I have already told you, but the most important is Prentice rule. Very important, very spectacle correcting lenses and the far point concept give a read only. These lines are very important. Moving a correcting lens closer to the eye, whether the positive or the negative, reduces its effective power, whereas moving further from the eye increases its focusing power. Please treat this concept very carefully. This is very important. And only give a read to this topic. This clinical pearl is very important. And all the clinical examples I have already told you are very important, but the clinical examples present in this unit are very important. Each clinical example, please solve them. Only a read for this to get the concepts. But this is very important. The following guidelines may provide helpful in prescribing the astigmatic spectacle corrections. Okay. Function for adults, okay, because of distortion, etc. This important point has come already in the exam. To reduce distortion, what you will do, use minus cylinder lenses and minimize the vertex distance. Okay, very important point. This is very important. Pentoscopic tilt, important. Prescribing glasses for the children, very important topic. Read thoroughly, please. Each and every line is important. Important. Myopia, very important. Okay. Very important again. Hyperopia, all these are very important. Remember that the appropriate correction of childhood hyperopia is more complex. This point is very important. Anisometropia and all the the things which I am telling are very important. It means the MCQs have come or can come in the next exam. Accommodative insufficiency, presbyopia. Now presbyopia is very important definition. Now what factors on which the presbyopia depends? The age at the onset depends on the pre-existing refractive error, depth of focus, patient's visual tasks, and other variables. Now, an MCQ has come already that the age at the onset of presbyopia depends upon what factors they were given. They remember that in the ICO exams there are 4 options in every MCQ, not 5 options. There are 4 options. So in 3 options they have given depth of focus, patient's visual task, refractive error, depth of focus, patient's visual task, and In the fourth, there were other variables. So you have to tick other variables because not only these but also on the other variables. Please remember this. Cumulative insufficiency, very important. Very important. What are the? It is due to premature loss of accommodative amplitude. Please remember, accommodative amplitude. There are reversible and the irreversible causes. Premature presbyopia by the drugs like tranquilizer drugs or the parasympathetic used in the treatment of GIT. Okay, in both these cases, the condition may be reversible. Please remember this. This is the reversible. And then these drugs are caused. Which drugs causes accommodative insufficiency? Okay, what are the irreversible causes? Encephalitis or closed head trauma? Closed head trauma. The most common cause of premature presbyopia, however, are unrecognized are the latent hyperopia and overcorrected myopia. These are the drugs. These are the drugs. But the most important cause of the premature presbyopia is this. Please read this topic very carefully. Also, accommodative excess. Very, 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 very important topic. These are there are different drugs causing the different iridocyclitis like okay anticholinergic drugs treatment of the glaucoma associated with uncorrected refractive errors, usually hyperopia, but also astigmatism. Please remember this very important, very important. Serious pause. This very important. Okay. So both these are topics are very important. The cumulative convergence is your A ratio important. Please read it. There will be MC in one attempt. There were two MCQs from this cumulative AC over A ratio. How to find that? Please read it. Spectacle correction. In the spectacle correction, these few lines are very important. Spectacle correction of a myopic patient gives the base in prismatic effect. Very important, okay? Prescribing multifocal lenses. Give a read. Only a read to these topics. Types of